CIO I talk to has the same problem with clinical AI right now. They have pilots running, they have vendors pitching, they have boards asking when this all turns into value and operating leverage. And almost no one has a clean answer for how these pieces fit together. My guest today runs the business that put ambient documentation in front of more clinicians than anyone else in the industry. He is now watching health systems try to scale that from physicians to nurses to radiologists and into revenue cycle and operations. So we're going to talk about what real production looks like, what the architecture has to go to next, and what is genuinely working. This is Megan Antonelli, CEO of HealthIMPACT Live, and this is Digital Health Talks. I'm here today with Kenneth Harper, General Manager of Dragon at Microsoft. Hi, Ken. How are you today?
Hey, Megan. Thanks for having me.
Yeah, welcome to the show. I mean, I can't believe for as long as I've known you guys over at Dragon, of course, at our friends at Microsoft, we haven't had a chance to meet. So I'm excited to finally meet.
Yeah, I appreciate you letting me come in and have this conversation.
Absolutely. Well, I think what's so amazing about, kind of your history and your background is, you're really one of the first folks to work on this, being at Dragon for almost over 20 years now. Tell us a little bit about kind of your background and how you got into it.
Yeah, happy to. I have a background in human factors, and I had this opportunity coming out of college to go work on a company that was doing voice recognition, personal assistance at the time is what we called it. And human factors is very much about, how do we interface with technology and how do we interact with technology to help improve our lives. And so it was just an opportunity that I got really excited about. I didn't know much about voice recognition, to be completely honest. But the first part of my career taking this opportunity was looking at voice and how you could create really powerful experiences for consumers on how you talk to your phone, to place a phone call if you're driving, or send a text message if you're driving for a hands-free experience, or how you can ask your TV to find a show that you want to watch because you want to go through the channel guide, or talk to your car and ask it to find directions for where you're looking to navigate to. And I worked on that for a very long time, more in the consumer industries. And then, halfway through my career, it kind of dawned on me, although it was cool what voice was doing, what personal assistance and AI was doing, it just didn't feel like the meaning was there as much in terms of the impact that this was having. And I started looking at what else was out there, what other opportunities were out there. And it just so happened that was about the time that my son was born. And I remember trying to take him in for a specialist appointment. And number one, it took 6 months to get the appointment, believe it or not. But even once we had the appointment, I do distinctly remember just the physician. She was great, but the physician was buried in the keyboard as she was interfacing with me and asking me questions about my son. And it was impersonal, and it was just, she was in the computer typing the entire time. And it was one of those moments where I said, I do wonder, what's in healthcare and how could this technology come into healthcare, and be used as more of that natural interface for how physicians are doing their work. And the stars lined up. And to make a long story short, I had an opportunity, in the same company I was working with, Nuance at the time, Microsoft now, to come into the healthcare division and stand up this new program around ambient. We didn't call it ambient exactly back then the way we do today, but it was this idea of, could we build an experience for clinicians where they walk into a room, they have a conversation with a patient, and smart things start to happen automatically. That was the idea almost a decade ago. Believe it or not, we've been thinking about this and working on it at Microsoft. And that started everything in terms of coming into healthcare, using this technology to solve real problems for healthcare workers. And what I will say, I know we'll talk about this more today, but the impact that it's had on care workers and how they're able to get their lives back and focus on patients. It's been an incredible journey over the last almost decade, just getting this technology out the door and seeing it scale to the point that it has.
Yeah, that's amazing. So how old is your son now?
My son just turned 8 years old.
Wow.
So yeah, it's been a great journey.
Yeah, no, and I mean, so many of us, I think, do get into healthcare and sort of make that pivot when we realized the friction in the system, and I think for many of us around the time our kids are born is that first real, if we're lucky, it's our first real engagement with the healthcare system to see just how many challenges there are to fix, right? And I think this one in particular, I think back to seeing the graphic of the physician, sort of at the computer doing the, while the patient sits and is, with his back to the patient. And, at the same time, this was when we were pushing electronic health records saying, we want this, we need more technology in healthcare, we need more of this. And yet this was the consequence of that. And I think what is so exciting about everything you guys have done at Dragon is how much that has changed the relationship between the hospital, the health system, the technology, the patient and the physician, and brought that back. So tell us a little bit, I think we talked a little bit about this before in terms of, our health systems are eager to adopt AI, eager to adopt ambient. The technology's been around for a while, but a lot of them are still in pilot mode. And it's, how do you get to that place where it is production? You're now seeing health systems who have had this in place for a very long time. So your perspective on kind of what they're doing and what the value that they're seeing, I would love to hear more about that.
Yeah, we definitely are now seeing this technology scale, in healthcare, but not everyone's at the same level of scale. There's still work to be done for sure, but we have over 150,000 clinicians now where Dragon Copilot, which is our latest version of Dragon, is helping them do their work. And so the scale is definitely there. What I would say, though, is where we've seen the most success, inside of organizations who view this as this is now an essential tool that every clinician should have, is they put some thought and they roll it out deliberately from an enterprise perspective. They don't just take it to one department or one specialty anymore. They really focus on how do we put a program together inside of our organization? How do we think about the change management, which is so critical for any new workflow tool that you're putting in the hands of clinicians? How do we put together a formal program to roll this out to enterprise, where every clinician should have the right to use this? And they think about it. They think about the training, making sure there's awareness that this tool is there, encouraging people to give it a shot, making sure that if folks have questions, that they get addressed in terms of how to make the most out of the tool. There are always, with any AI, there's always some tips and tricks of what you can do to really make it work well for you as a clinician. And really what happens is you begin to see this flywheel, because inside of an organization, when all your colleagues are using something, you hear about it. And people start talking about what they're doing and the impact that it's having on their practice and their patients. And the more people hear it, the more people want to try it. It's almost like the self-fulfilling prophecy of everyone's talking about it, and it creates a lot of buzz in the organization. And before you know it, your entire organization is lit up. And so I think, to answer your question, the organizations that we've seen do this well, Advocate is one example. They're one of the first to really think about rolling this out from an enterprise perspective. We want everyone to have the right to use this tool. They've just been a phenomenal partner of ours, but they've put so much time and energy to make sure they've thought about that change management and making sure the support system was there to make it successful. And it's really about that leadership team in the health system saying, we're all in on this. There's no debate on it. We're all in on it, and we're going to make it successful with our clinicians.
Mm-hmm. Yeah, I think that's, a lot of the things that we've heard in the past is, you'll hear that they don't want it taken away. Those who have it love it. And it sort of spreads like, wildfire, and they want, the others in the departments want it. Tell me a little bit about, is there, what's involved in terms of that? If you're taking it from the clinicians, physicians, if you say you pilot it with one department and then you go to a next, what does it look like, or how do health systems really need to rethink or think about that clinical AI deployment when it's going across roles? Yeah,
they definitely think about putting together educational materials, and I've seen some organizations do webinars with going from specialty to specialty, where they have everyone come in to make sure folks know what this is and how it's going to change their lives. There's a lot of education and evangelism that they do. And so I think going back to creating programs and creating content and collateral that they take to all the different specialists and departments and where they're rolling this out, and make sure folks understand it. They are very deliberate, and on this day, this is what you're going to get, and this is the time commitment we're asking from you to get set up. So they don't leave it to chance, I guess is another way to say it, where it's not, you just get an email of like, go try this thing. No, they really put some structure around making sure everyone has the opportunity to try it, and carving away some time, for that provider, to get set up with it and give it a try. And so it's one of those, I think it's a recognition amongst leadership that, sometimes you just got to give someone a little bit of time to go try a new tool, because if they go in, they start using it, it's going to have such a big impact on the outcomes that clinicians then seeing.
Yeah. What would you say, in terms of best practices around training? We talk about the pit a lot on this show lately.
It does come up a lot. A lot of our internal forums, it definitely is a bit of work research. Yeah.
And they hit all of our top topics, in particularly this season. But you see where Dr. Sandoz is, she's being told to use it, she uses it, but she hasn't really been trained on it. It's kind of, how do you use it? Are there best practices? I don't proclaim to say that the pit is a realistic view of how those things get rolled out. So, but from your perspective, what are the best practices for that kind of training? Or even if there's not in the ER on the day that the power's down, but other days.
Yeah. Take what you see on the pit and assume that's not the best way to roll this out, to get successful adoption and make sure those outcomes are there. That's probably not what you want to do. It's really simple things. It's, making sure you have the folks on the ground, that can go and talk to clinicians and get them set up. Microsoft, we've made a huge investment in this, on actually having a client success team that we send on the ground, to work hand in hand with healthcare leadership. We know how important it is to walk the halls and make sure folks those first couple of days get the help that they need. Because again, there's always some tips and tricks that you want clinicians to know to get the most out of the technology. It's not that hard. Your typical clinician can get up and running in 5-10 minutes. But then how do you sort of optimize that experience for how that clinician practices? There are things that you can do by walking the halls to help them and answer questions. And so having a team on the ground, working with a vendor that actually has the know-how and resources of making sure that the success is there during the rollout, it's incredibly important. And so you're going to want to sit down with a clinician and carve out 15 minutes where they're not interrupted. They're not in the middle of running from patient to patient. You want to sit down with the clinician, 5-10 minutes, explain it, get them set up, go in, watch what they're doing the first encounter, maybe give some tips and tricks on, hey, if you just vocalize a little bit more, because this is a co-pilot on your shoulder, it's listening to every word you say, you're going to get even a higher quality note. Or, hey, you have a special template that you want to use. Hey, did you know there's this tool in Copilot where you can go in and tell Copilot, this is how you like your exam findings captured. There are all these little bells and whistles, that we build into the product, to really make Copilot work for every clinician that's using it. And it's important to work with an organization, have a team on the ground that can make sure all the power of the product, gets opened up.
Right. Well, and I think, we hear so often, this move from, and they don't want these point solutions, right? So when I think about the power of kind of Dragon and Copilot together, that's a really strong story. So tell us a little bit about that, and tell me a little in terms of, does that also impact, non-clinical functions like, clinical documentation around like prior auth and revenue cycle? Where are those intersecting and helping health systems? Yeah,
well, what I would start is Dragon Copilot, which is just our latest generation of Dragon. It is a comprehensive clinical assistant. That really is how we've designed it. It started many years ago, almost a decade, like 8 years ago, was when we had our first version of it. It started around documentation because that was the biggest problem to be solved, and where we know we could save lots of time in documenting something. purely based on what you're doing and talking with a patient. And all those outcomes have been proved. Over the last several years, we save hours a week for clinicians just purely in their documentation time. But where we're going with Copilot is there's so much more opportunity of how a clinical assistant can help you throughout the course of the day. You might need help with your orders. You might need help with diagnoses. Bringing more coding intelligence into the point of care where, hey, if you serve up a nudge, if there's something a little bit different that you need to capture in your documentation to make sure a procedure gets authorized for a patient given their payer information, all these things are now beginning to be part of that one universal Copilot experience that not only clinicians can use, but we also have it for other personas in the health system. We have a Copilot for nursing where it's acting very similar. It's a natural language interface and can understand ambient conversation, but the work's a little bit different. What a nurse is doing is different from what a physician is doing. The data they need to capture, some of the help that they might need throughout the course of the day, it's a little bit different. And so we think about Dragon Copilot as really it's a framework of point solutions that can be tailored to very specific personas, but it's all running as one sort of consolidated capability or platform, if you will. And so it's a really important aspect of the scale and the impact inside of healthcare. If you're working more as Dragon Copilot is this broader set of capabilities, and then you can turn on certain features by the persona. It's really how you get the most value out of the capability.
Yeah, absolutely. And I mean, as we look at the healthcare system, it's, I think the fragmentation and the sort of the siloed of the departments and divisions is such a big piece of that. So that integration layer is so important. And we've seen that a lot in the discussions that we've had around that. So tell me a little bit more about, kind of where the next few years is going. Like, you've been at it since, over a decade now in terms of what's to come in terms of the programs that for the healthcare systems.
Yeah, there are a couple things I would say that get us really, really excited about where we're going. One, just to sort of segue from your last comment around consolidation, we do view Dragon as becoming what we call internally the UI for AI, meaning it is a workflow that is already being used for a lot of your work, but now it's connecting to all your applications. It understands what you're doing in the EMR, understands what you might be doing in M365, it understands all the clinical data that you might be working with. A lot of folks tend to think that the clinical data you're working with only resides in electronic health record. That's one source of data, but you might also be going to a third-party website like UpToDate and looking at a clinical protocol of something that you need to follow for a diagnosis you haven't seen in a while. There are all these different sources and all these different applications, and Dragon is becoming this centralized natural language interface that connects you to all of it inside of one workflow. And so that's a big aspect of what we're now doing with Dragon. The other aspect is, and this has always been true from the early days of ambient documentation, this vision, which we're now actually realizing, is how can we actually bring intelligence into the ambient experience because we now know what's happening between provider and patient while it's happening. And what gets us excited about that is if you think about what has happened in healthcare historically, all of these best practice alerts and nudging systems and clinical decision support tools have always required data being entered somewhere before an alert might come into focus, or a nudge, or a best practice of this is actually the right treatment plan for a patient that has these types of conditions. You have to talk to the patient, go put information into a system, and then these alerts come to the foreground. And so alerting in healthcare historically has been retroactive. It happens after the fact. And what we're excited about with ambient, Dragon Copilot and ambient now running at scale, we're now understanding what's happening in the moment between provider and patient, combined with data we're pulling out of the historical record of the patient, how to use all that context and what you're discussing with the patient while the patient's in the room to bring intelligence in, serve it up to a provider while the patient is still sitting there. And there's an opportunity to intervene. And so an example of this is in Dragon Copilot now. We have an open framework where anyone can come in, any third party that might be building a really unique skill can plug into Dragon. One of the partners that's plugged into Dragon now is a company called Canary Speech. And what they do is they take that audio snippet that is in the ambient recording, because Dragon's running and we understand what's being discussed with the patient. They can take a snippet of audio, they run it through a series of models that they've trained, and they can bring back into workflow for the provider an indication of depression probability, anxiety probability, and also flag early signs of neurological disease. And so imagine someone coming in to primary care for an annual visit. Maybe they really aren't comfortable answering some of the survey questions that you get in your intake, around your mental health and your feelings of safety. But this is a technology that goes through that, because it actually looks at the audio of the patient's voice and tries to detect signals of depression. And by seeing that in workflow, while the provider is still talking to the patient, the provider now has an indication, hey, maybe you should ask a follow-on question. Maybe you should nudge a little bit and see if this patient needs some help. And I've already heard one testimonial for someone that's using this in production, that they had a grandmother come in and everything seemed fine. No issues on the survey or the intake information. Everything was fine. It was an annual visit, healthy, no major medical concerns. But because this was running as part of the ambient dial tone, they got an indication that the patient had high probability of depression. And so they just asked and nudged a little bit more what was really going on. They actually went into a 5-minute discussion about the grandmother's son had just moved. She no longer has access to her grandchildren, which was a huge part of her life. And she was really struggling with it. And by having that conversation and knowing to nudge, to have that conversation, you're able to actually make sure that the patient's getting the help they need, through some downstream referral therapy in this case. But this is one example of where we're going with Dragon, and where we're going in healthcare is there's so much technology out there and so much innovation, but how can we bring that innovation into workflow in one consolidated place where we can begin to change care? Because we know what's happening between provider and patient, and we can intervene when there's an opportunity to talk to the patient or help the patient, or even just augment your decision making as a clinician with some piece of information that maybe you weren't aware of. This is how we're going to really start to see something like Dragon and what we're doing with Dragon Copilot begin to impact the delivery of care. And that's really what gets us excited about the future.
Yeah, no, that's amazing. And that's exactly what is so exciting about it, right? I mean, the elements of, reducing burnout and reducing time, 4 hours, 5 hours, 50 hours, however many hours it is that it reduces, it is great. And it's important. And in many cases, those hours shouldn't have been there. And the system is a bit broken that puts it there anyway. And it's good to have a tool that gets rid of it. But the ability to actually practice medicine better and make them better clinicians is what's going to make them really love the tools, and the patient love the tools and the patient better, right? And it's just so exciting to see that coming together. And I think that power of these tools to kind of create that infrastructure. I love what you said in terms of the OX for what is UX for AI.
The UI for AI is what we say. Yeah.
Hopefully Canary's not listening to my brain degrade in real time, but it's UI for AI. But it is, I think it's an amazing kind of layer of this that is so exciting. Tell me a little bit in terms of Canary. Is that embedded? Is it a partnership? How does that? Is it you turn it on? It's just there?
Yeah. What we're doing at Dragon Copilot is we're opening it up through a open framework, very similar to how you can think of an app store with your phone. We're not discriminating who can plug in. Anyone, and this is really the power of Microsoft and why we're excited about bringing this to market, in that we're open, and Dragon's already on the workstation of hundreds of thousands of clinicians. So how do we let the ecosystem plug their skill into Dragon in more of a self-service way, where you don't have to go and try to do partner by partner, deal by deal, integration by integration. You have all these one-offs. It takes forever to scale innovation. Instead, the idea of a marketplace is you open up what Dragon is in terms of how you can plug into it and how you can get context from it, and then how you can plug some unique skill back in. And there's thousands of companies that focus in very certain areas of healthcare. In revenue cycle management, you have companies that just do prior authorization and looking at guidance that you can serve up to make sure procedures are approved. There are companies that focus on inpatient guidance. How do you look at context about the patient and try to identify opportunities where you might be missing a diagnosis of something that, like sepsis, that you really need to be aware of. There are companies out there that specialize in other aspects of coding, like in ambulatory. How do you make sure you're capturing the right information? And based on the work you're actually doing, how do you make sure you're actually billing at the right level, based on the work you actually did with the patient? There are other companies that bring clinical intervention. Canary is one example, but a clinical intervention around, this is a clinical protocol that we know is a best protocol to follow for a patient that has these conditions that you're currently treating. There are hundreds, thousands of these types of companies out there in healthcare, but they're missing two things. They're missing one, what is the context of what's happening in real time when the patient's in the room? And that's something Dragon can solve. And the second thing they're missing is, how do you actually plug your skill into a workflow that clinicians are already using where you're in workflow? And Dragon is also solving that problem. And so we really view this as opening up innovation at scale in Dragon by letting all these partners come in through a self-service ecosystem. And then the healthcare organization, they get to turn on or off, very much like how you manage apps on your phone, but each healthcare organization can turn on or off these plugins, these skills, if you will, based on the ones that are most valuable to them. And so it really is about self-service and scale to bring the most innovation to our healthcare clients.
Oh, wow. And that, I think I've always thought about it from the sort of broader, sort of integration with Epic and the partnership with Microsoft, and that is the power of this. But in fact, now you're also bringing in the power of this ecosystem of Microsoft partners that people can access through there, which then takes care of that, sort of point solution problem by creating a platform for the health systems as well on both.
That's exactly right. And why that's also, we think of it as the UI for AI, right? Because it's the thing that you talk to, the thing that you interact with, that gives you access to the ecosystem of innovation.
Right. I need one for event production too. Does Microsoft have that?
We'll work on that.
I know, but it's this sort of we're in this phase of, sort of hyper innovation adoption that is overwhelming. And I think it's overwhelming at an individual level and at an enterprise level. And, sort of the way that you guys are approaching it makes it at least manageable from that place for the health system. So I wish we had a little bit more time, but we're running out of time. We always like to end on, we have a segment called 5 Good Things. So in thinking about kind of what's good and what's great that's coming, what is your, sort of most excited development that you see coming within healthcare, whether it's digital health or healthcare more broadly?
Yeah, I think the most exciting thing about what's happening in healthcare is AI is actually solving real problems. This is not in a lab. It's not in pilot phase. It is solving real problems. And I think we're going to see this transformation. I think this idea of becoming a frontier firm, a frontier AI firm, in healthcare, I think healthcare is actually embracing it in a way that maybe we haven't seen historically in healthcare in terms of embracing technologies as early. Healthcare, I think, as an industry, is really seeing the impact AI more broadly, can have on everything they're doing. Care delivery, back office operations, all the different personas that they have, even front end workers, in the hospital system and the patient experience. Thinking about someone calling in and trying to get help about how to navigate their care. AI is here in a way that's going to solve a lot of these issues. So I think when you see in the industry people talking about a frontier firm. I think what's exciting to me in healthcare is I think healthcare is actually, for maybe the first time in a technology revolution, almost be at the forefront, of really having this technology solve some really meaningful problems.
Yeah, that is it. That is very exciting, and it's an unusual place to be, at the front edge of innovation versus the lagging behind. But to your credit, kind of being there earlier with Dragon, you have brought us there. So tell our audience where they can sort of learn more and follow up.
Yeah, if you go to Microsoft.com/health, you'll find out everything that Microsoft is doing in healthcare, inclusive of what we talked about today with Dragon Copilot.
Perfect. And we'll put that link in the show notes too. Well, Kenn, thank you so much for joining us. It was really a pleasure to learn about this, in greater detail. It's such an amazing thing. We have such a lucky opportunity to host our Health Impact Forum at the Microsoft offices in New York. And, it is a great opportunity where all the partners do kind of come and meet. So I hope we'll see you there, as well as some of our listeners, October 6th and 7th. In New York. And to our audience, thank you so much for joining us. That was Kenneth Harper, General Manager of Dragon at Microsoft. What was provided was a really incredible, useful map around clinical AI and where it is right now and where it's going next. For our listeners, I think the takeaways are pretty clear. The health systems are pulling ahead, are the ones connecting AI to operations, not just to documentation. And you can think of the Dragon platform as the UA for AI. And that matters more than any single tool. And the case for optimism is strong. So if you like this conversation and you agree that this is the whole point, share it with someone who needs to hear it. Subscribe to Digital Health Talks and follow us on YouTube at Health Impact Live. This is Megan Antonelli, CEO of Health Impact Live. This is Digital Health Talks. Let's keep fixing healthcare one conversation at a time.